we will talk about how to reduce bad cholesterol. It affects around 40% of adult population, so it's a huge problem. And let's define what means high cholesterol or what means bad cholesterol or good cholesterol. Generally, all cholesterols are fats. Predominantly, they are fats, types of fats. And imagine tunnel with trucks loaded with sticky substances. They are moving, and sometimes these materials spill over from these trucks and they stick to the walls of the tunnel. And after some period of time, this tunnel is blocked and traffic is blocked, and it's impossible for ordinary cars and vehicles to pass this tunnel. That's the idea of cholesterol. Cholesterol are fats, they are sticky, they stick to the walls of arteries, and at some point they can block blood flow at all, and when they block blood vessels, we get myocardial infarction, or we get stroke, or we get other diseases, but these two are most dramatical. That's why we mention, because it depends where this cholesterol will block blood flow. If it happens in heart, we have myocardial infarction. If it happens in brain, we have stroke. So we have two types of cholesterol, main two types of cholesterol, if we categorize them broadly: bad cholesterol and good cholesterol. Bad cholesterol looks like this sticky material which stick to the walls of arteries, and good cholesterol looks like cleanup crew which are cleaning this tunnel, and they clean this tunnel, and this good cholesterol predominantly are protein which can bind to these sticky fats, and it can clean arteries and it can clean blood vessels. That's why it is called good cholesterol. So if we have good cholesterol high, it's good. If we have bad cholesterol high, it's bad. Now let's say how to decrease bad cholesterol naturally. First and most common and most evidenced supplement and substance is omega-3 fatty acids. Omega-3 fatty acids are essential for our body, and they reduce inflammation, and when they reduce inflammation, they reduce creation of atherosclerosis. They reduce these sticky fats to attach to the walls of arteries. They also reduce synthesis of triglycerides in the liver. It means that they inhibit, they stop production, they decrease production of fats in the liver. Triglycerides are fats, and they increase level of good cholesterol. Here is important question, that what is the optimal dosage of omega-3 which will have some therapeutic effect and which will decrease bad cholesterol level? This dosage usually is to 4 grams per day, EPA plus DHA. EPA and DHA are types of omega-3. And after what time will be the effect? Effect will be after 1 month usually. And if we compare it to first-line medication for high cholesterol, how effective omega-3 fatty acids are, because maybe we say that yes, they are effective, but they are not as effective as chemical medications. That's true. Statins are the first-line treatment of high cholesterol, and they are more effective actually. They reduce LDL or bad cholesterol by 50%, while omega-3 fatty acids decrease bad cholesterol only 10%. So it means that statins are 5 times stronger than omega-3 fatty acids, but this decrease in 10% still important. In terms of triglycerides, omega-3 fatty acids are stronger here. They decrease up to 30% triglycerides, and statins usually decrease around 20%. These triglycerides also considered as bad cholesterol. So, but most important and most abundant bad cholesterol is LDL, but triglycerides are more classical fats, and they still considered as a bad cholesterol. And now let's say what food contains omega-3 fatty acids. Fatty fish, especially salmon, mackerel, and other almost any fish contains omega-3 fatty acids. So it's important to intake fish twice a week. Also, nuts contains omega-3, flaxseed contains, but we should mention that nuts and flaxseed contains ALA, not DHA and EPA. So EPA and DHA are form of omega-3s which are most important and which has benefits, important health benefits. ALA also important, and from ALA we can produce, our body can produce omega-3 fatty acids like DHA or EPA, but this conversion is limited, so nuts and flaxseeds are not as effective as fish. It's important. Second most important and well evidenced substance or material which reduce cholesterol is soluble fiber. And from soluble fiber, oats, beans, lentils, and apple and psyllium are important, and dry fruits, they contain soluble fibers. What means soluble fibers? The idea of soluble fiber is that they can bind cholesterol, and when they bind cholesterol, they prohibit their absorption. So our liver producing biles, and bile are cholesterol also, and this fruit, for example, this apple or psyllium or dry fruits or oat, they bind these bile acids from liver, and they don't allow this bile to reabsorb again into intestine. So every time you intake these soluble fibers, your liver needs to use more and more cholesterol, and it takes cholesterol from blood. That's why our liver cleans our body from cholesterol when you're eating soluble fiber. That's the idea. If we say how effective they are effective. They contain soluble fibers, but it's not very important amount, and we should know that we need around 5 to 10 grams of soluble fiber per day to have therapeutic effect. And if you want to get 5 grams of soluble fiber from apple, you need to eat 4 apples. So it's important that if you eat 4 apples, yes, you get 5 grams of soluble fiber, which has effect on cholesterol. It decreases cholesterol level around 10%. LDL, bad cholesterol, it decreases bad cholesterol around 10%. Also, 100 gram dry oat also contains around 5 grams of soluble fiber. Dried fruits contains less. They contain around 3 grams of soluble fiber per 100 grams, and psyllium is richer. 1 tablespoon of psyllium contains 5 grams of soluble fiber. So if you really want to intake soluble fiber, you should eat oat, apple, or dry fruit, or best solution is psyllium. Psyllium is a supplement in many cases. Third most important cholesterol lowering natural product is sterols and stenols. They are sold as supplement also, and they are additives for margarine also and dairy products. And what they are doing, they look like cholesterol, and they look like this cholesterol and then compete cholesterol absorption, and they inhibit cholesterol absorption because they compete them. That's the idea of sterols. Sterols also decrease LDL level around 10%. They're effective, and American Heart Association recommends around 2 grams of sterols and stenols daily to intake from margarines or dairy products, because they are usually fortified. And if you eat margarine or dairy product, it's better to intake fortified by sterols and stenols. It's important. And here's question also: if during baking process these sterols and stenols are loose and lose their effect, or they still beneficial. They are still beneficial. Of course, some part of sterols are lost, but most of them are retained. Most of them molecules retained, and they still effective even in baked products. And fourth important way to decrease cholesterol level is exercise, especially aerobic exercise. And it's well evidenced that 30 minutes of aerobic exercise daily decrease LDL level around 5%. It increase good cholesterol level around 10%, and it decrease triglycerides around 20%. If your exercise level is more intense, these benefits are higher. For example, if you exercise intensively, then it decreases LDL level around 12%, and if you exercise intensively, HDL can be increased around 10%. So benefits increase when you increase your exercise intensity. That's why exercise is important, especially walking, jogging, cycling, swimming. So aerobic exercise is very important. And niacin or vitamin B3 also can decrease cholesterol level, but very high doses are needed, and these high doses can have important side effects, adverse effects, especially on liver. That's why it's not advised to intake niacin without supervision of doctors. That's why you should be careful if you intake niacin, especially in high doses, but they are really effective. And meats and nuts and liver and avocado contains niacin, so you can intake them from foods, some amount, of course, not such high doses. For therapeutic effect, for important reduction of cholesterol, the high doses are needed, but even in moderation and even in low doses, it can have some help for your cholesterol. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.